Our mnemonic this time is APGAR. It is a backronym used to assess newborn babies. APGAR score. The APGAR score is a method to quickly summarize the health of newborn children against infant mortality. Virginia APGAR, an anesthesiologist at New York Presbyterian Hospital, developed the score in 1952 to quantify the effects of obstetric anesthesia on babies. The APGAR score is determined by evaluating the newborn baby on 5 simple criteria on a scale from 0 to 2, then summing up the 5 values thus obtained. The resulting score ranges from 0 to 10. The 5 main components of the acronym are the following. First, appearance. Second, pulse. Third, grimace. Fourth, activity. And 5, respiration. First is appearance, which is judged by the skin color. A score of 0 is given when the skin is blue or pale all over. A score of 1 is given when the skin is blue at the extremities and pink at the body, aka acrocyanosis. A score of 2 is given when there is no cyanosis and the body and extremities are pink. And that makes the appearance component of the APGAR score. Second is pulse, which is judged by the pulse rate. A score of 0 is given when the pulse is absent. A score of 1 is given when the pulse rate is less than 100 beats per minute. A score of 2 is given when the pulse rate is more than or equal to 100 beats per minute. And that makes the pulse component of the APGAR score. The G stands for grimace, the criteria for which is reflex irritability grimace. A score of 0 is given when there is no response to stimulation. A score of 1 is given when there is grimace on suction or aggressive stimulation. A score of 2 is given when the baby cries on stimulation. And this is what makes the grimace component of the APGAR score. This, A, stands for activity, the criteria for which is muscle tone. Here, a score of 0 is given when there is no activity seen. A score of 1 is given when there is some flexion. A score of 2 is given when the arms are flexed and the legs resist extension. And this is what makes the activity component of the APGAR score. And the 5th and final part is respiration, which is assessed by the respiratory effort. Here, a score of 0 is given when there is no respiratory effort seen. A score of 1 is given when the respiration is of weak, irregular, gasping character. A score of 2 is given when the respiration is strong or presenting as a robust cry. And this is what makes the respiration component of the APGAR score. This is what the complete APGAR score looks like. The test is generally done at 1 and 5 minutes after birth and may be repeated later if the score is and remains low. Scores of 7 and above are generally normal. 4 to 6 are fairly low. 3 and below are generally regarded as critically low and cause for immediate resuscitative efforts. This is the end of the video. Check all kinds of medical mnemonics in this ongoing series. You can find the videos in the cards.